My name is Muskander Irfan.
Hi, my name is Delina Arcia.
And I'm Enzo Trujillo, and today we'll be giving the step-by-step on how to control bleeding and treat wound care. So explaining what laceration is, it's basically an irregular cut in the skin caused by a sharp object. Treatment for a laceration typically depends on just how deep the cut is, as we'll see in the following demonstration.
Oh, crap!
Before administering care to an ill or injured person, check the scene and the person. Size up the scene and form an initial impression of what's going on. If the person becomes unresponsive or the cut is way too severe, it is always important and essential to call 911 and report the following wound or injury to a healthcare provider. Lacerations often involve a lot of blood, and you should avoid getting another individual's blood on you if possible. If not, you will become infected. If you are not the victim, practice universal precautions and wear personal protective equipment, in this case, gloves. First, to control the bleeding before anything else, put pressure directly on the laceration while holding it above the level of the heart for 15 minutes should be enough to stop bleeding. If not, try using pressure points. Once the bleeding has stopped, wash the laceration and the surrounding areas with warm water and mild soap. Apply an antibiotic ointment to reduce the chance of infection. In some people, antibiotic ointments may cause a rash. If this happens, stop using the ointment. And finally, put a sterile bandage on the wounded area.
Amputation is the removal of a body part. This can be done by a doctor in a hospital setting, such as when a foot must be amputated because of diabetes complications, but amputation may also happen during an accident.
Seeing how severe the situation is, immediately call 911. Have personal protective equipment on you to prevent getting the victim's blood on you. Wash your hands with soap and water if possible. First step you should take is to apply direct and steady pressure to the wound. Cover it with a coat or blanket, and if there's an object in the wound, apply pressure around it and not directly over it. In some cases, the amputated part can be reattached, but if not, place it in a clean plastic bag, pack it with ice, and take it with you to the hospital. Calm the person as much as possible until medical help arrives. Clean the wounded area and rinse it with clean water to remove the dirt or debris. Do not use soap or scrub. Wrap or cover the injured area with sterile dressing or a clean cloth. Puncture wounds can be deep or shallow and large or small. Treatment depends on the severity of the puncture wound and the size and the speed of the object creating it. An object that is sticking out of the skin is called an impaled object. A bullet wound is a type of puncture wound created by high speed and often leaves the object still under the surface.
Ow!
First off, analyze the scene. If the object that caused the puncture is small and you can easily remove it, do so. If it's too big and the injury looks way too severe, call 911. Apply firm and direct pressure with sterile gauze or a clean cloth until the bleeding stops. Rinse the wound under clean water for several minutes. Then wash the area with mild soap and water and rinse it again. Apply an antibiotic cream to disinfect the wounded area. And finally, use a sterile bandage to protect the puncture wound from dirt or further injury.
Avulsion. Skin avulsion is a wound that happens when skin is torn from your body during an accident or other injury. The torn skin may be lost or too damaged to be repaired, and it must be removed. A wound of this type cannot be stitched closed because there is missing tissue. Avulsion wounds are usually bigger and have more scar because of the missing tissue.
The first step to treat an avulsion is to stay safe. Practice universal precautions and wear personal protective equipment. Control bleeding with direct pressure and elevation. Avoid tourniquets unless bleeding cannot be controlled and if medical care will not be available for several hours. Rinse the wound with water or saline solution. The cleaner the better. Sterile irrigation is the best. This will restart the bleeding in many cases, but that's okay. It's good to clean the wound as well as stop the bleeding. If the tissue is not completely torn away, replace the flap and dress the wound. But in some cases, the tissue will completely be separated from the patient's body. If this happens, collect it if available and bring it with the patient to the emergency department. And finally, use a sterile bandage to wrap the wounded area from dirt or further injury.
Cuidado, no te cortes la cara.
Ow, I cut my finger! I don't know.
Yep.
Wait.
Yeah, okay.
Turn it over.
Shit.
Okay, stop the video.
No, I can't get my finger out. Okay.
Puncture wounds can be, you're holding it like wounds, and the size and speed of the object creating it. An object that is sticking out of the skin is called an impaled object.
Avulsion. Skin avulsion is a wound that happens when skin is torn from your body during an accident or other injury. The torn skin may be lost or fudge.
I cracked the